Okay, so now we're going to cover chapter 4. So this covers more than just whole body terms. It actually starts by talking about cells and tissues, and then some of the more common medical terms that are associated with cells. It also goes into body planes, as well as just some of the basic landmarks, abdominal landmarks, and then it goes a little bit into the spine as well, okay, the different segments of the spine. Okay, so let's start off structurally. We're going to start off at the basic, the smallest unit within the body is the cell, okay? It is the smallest unit. It is the most numerous as well, okay? And so we'll talk about different kinds of cells, and when you actually group certain cells together that have the same function, we actually then get the next level of structure called a tissue, okay? And once again, tissues are groups of similar cells with a specialized function, okay? So this is just a basic example of a cell, and most cells have all of these little small organelles within each cell. The only cell that's a little different in our body is our red blood cell. Red blood cells don't have a nucleus, but this is the basic setup, basic environment of every single cell in our body. This particular photo is listed on page 61, and it doesn't actually have all the inner structures in here. It has most of them. All of these little structures within the organ are called organelles, and that suffix L indicates that something is small or a smaller version of, okay? And so the book goes through these specific ones. If you were to study a cell biology class, you'd find out that there was more, but this covers the bulk of them, okay? And so the ones that are listed here, the biggest one to kind of start out with is the nucleus. All right, the nucleus holds all the genetic material within the body or within that cell. And then the nucleolus is within that nucleus, and that actually produces ribosomes. So there's RNA in here that actually produces ribosomes. Then we have the lysosome that also ends in SOME. Lysosome is sort of the vacuum cleaner of the cell. It secretes enzymes. It helps to break down debris and get rid of any excess waste products that are made. Centrioles look like little asterisks, and they help during cellular replication. We actually form two daughter cells from one mother cell. Ribosomes are very small little structures. They look like little polka dots within this gel-like material, which is called cytoplasm. And so they are the producers of proteins, okay? And then if we come down over here, where number 1 is, I probably should have started with 1. 1 is the cell membrane, and so the cell membrane is basically what encompasses all of these organelles, as well as this kind of gel-like substance called cytoplasm. There has to be an environment for these organelles to be suspended within, and so that cytoplasm is sort of gel-like, and it helps provide nutrients and gives some stability to these organelles. Okay. Then we have a specifically important envelope kind of system in here called the endoplasmic reticulum. And so the endoplasmic reticulum can be smooth or it can be rough. And the rough is listed over here. So when these ribosomes that make proteins are actually attached to here, it's called rough endoplasmic reticulum. And if these envelopes that don't have the ribosomes are called smooth. And there's a lot of protein production and packaging that goes on within the rough endoplasmic reticulum, and the smooth produces fats and lipids, okay? And then we have this special kind of bean-shaped area right here called mitochondrion, and the mitochondria is what actually is the powerhouse of our cell. Greater than 95% of all the energy that drives all of our cells is made within the mitochondrion in the form of ATP, okay? And so this is our basic structure of the cell. So just having a generalized knowledge of what each one of these little structures does, and page 60 and 61 kind of go through these basic functions, okay? So when we go the next level up, we have cells that are the basic unit, and multiple cells of a similar structure make a tissue. If we take multiple tissues that arrange together to perform a particular function, then that's when we start getting an organ. So what organs are within the body? We have the heart, the lungs, the skin is an organ, the pancreas. So all of those organs are groups of tissues that are arranged together that actually perform a particular function. And then when we take multiple organs together, we then get what's called a body system. If we have the lungs and the heart, we have the cardiopulmonary system. If we include the blood vessels with the heart, then we have the cardiovascular system. And so when we put different organ systems together, or organ systems, it becomes a body system. Now there are some important terms that are related to cells, and these particular definitions are listed on page 62. And so it is important to kind of understand this, because these are specific terms that actually relate to cell formation or lack thereof, okay? And so these are all listed on that page 62. And so when we look at the word anaplasia, ana means not or without, and the suffix plasia can be a suffix, but it can also be a combining form. And so the combining form of plasia is plazo. When you put ia on the end of it, it means pertaining to, okay? And so plasia pertains to formation or growth of cells. And so when we have anaplasia, then we have a change in the structure and orientation of cells that are characterized by a loss of differentiation and reversion to a more primitive form. So key words from there are basically a loss of structure and orientation that reverts it to something that's more primitive or more basic, okay? The term aplasia, a also means without and not, very similar to ana. But when we have something that's aplasia or aplastic, that's another word. IA and IC both mean pertaining to. So that this is pertaining to the complete lack of development or growth or formation of an organ or tissue. So if somebody has a renal aplasia, that would be complete, there'd be a non-formation of that particular organ, okay? So ana kind of refers to a change into a more primitive form, to where aplasia indicates a complete lack of, okay? Dysplasia, dys means painful, bad, or disordered. And so when we're looking at the definition of this is basically an abnormal development of cells, tissue, or organs. So it's a disordered formation, okay? This often indicates some sort of cancerous formation or something that's dysplastic, okay? It is bad or difficult or abnormal in development. Then we have two words that are very similar to, well, no, I'm sorry, not similar, they're opposites. Hyperplasia and hypoplasia. So hyper, if you remember from chapter 2, the prefixes means excessive. Hypo means under, below, beneath, or less than normal. So if we have hyperplasia, then we actually have an increase in the number of cells of that body part, or excessive cell formation. If we have hypoplasia, then we actually have like an incomplete or underdeveloped organ, okay? And so there is a difference between anaplasia, aplasia, and hypoplasia, okay? So make sure you take a look at the book, okay? And so hypoplasia is more of a decrease in the number of cells that are formed. Hyper is excessive formation, hypo is less than normal production of cells or formation, okay? And then neo means new. So neoplasia is usually abnormal cells, but those abnormal cells aren't necessarily cancerous. They could be benign or malignant. So a neoplasia is something that is a new formation that could be malignant or could be benign. And so these, I understand, can be a little bit complicated off the bat, but using your knowledge of the prefixes can sometimes help differentiate between these. And once again, these are specific terms related to cellular formation and growth. Okay. Then if we go the next step up from cells, we have tissues. And so there are 4 kinds of tissue types. And the book does go through this as well on page 62 and 63. And these are important. Once you get into anatomy and physiology, these tissues are going to be entire chapters, information that encompasses an entire chapter. And so when we look at tissues, there are 4 important types. Connective tissue, which is our tissue that sort of supports and binds our body tissue. That could be ligaments, tendons, fascia that keeps muscle attached to bone. It is the most proliferative and most widespread tissue throughout the body. Okay. It also includes blood. When you have cells, because blood has cells in it, blood is also considered a type of connective tissue. Then we have epithelial tissue. Epi means on top, and IAL or AL, the suffix AL refers to pertaining to. Thel kind of refers to skin, and so this is a skin covering, whether it's internal or external. Okay, so epithelial is just a type of tissue that covers an internal or external surface or organ. Then we have 2 specific types of tissues that are very important: muscle and nervous tissue. Nervous tissue is a specific tissue that can transmit nervous impulses by the movement or changing in permeability of ions. Okay, and then we have muscle tissue, and muscle tissue has 3 different types. We have skeletal muscle, which is our voluntary muscle that attaches muscle to bone and allows us to move. We have smooth or visceral muscle, which actually lines the internal organs or even the blood vessels. And so you'll see the word visceral. Visceral refers to organ. And then we have cardiac tissue, which is the tissue that lines the muscle of the heart. Okay. So now we have a question. So we have the blank, or the smallest structural units, leading up to blank, which performs important bodily functions. So another way to look at this question is we're leading from the smallest to the largest. Okay. So what is our smallest structural unit and what is our largest bodily function? And so in this particular case, cells are our smallest unit and the body systems are the largest. Okay. And so it says, of the 4 types of tissues, how many do you think are involved in a body system such as the digestive system? And what we'll find after looking through all of this, and as you go through this whole, this whole course, we'll find that most of our body systems involve all 4 of these tissues: connective, nervous, muscle, and epithelial. Okay. Okay, so now we're going to go into body planes. This is really important because when you're describing what's going on within your body, whether it's an appendage like an arm or a leg or an area on the skin, being able to describe where you're talking is extremely important. And so these body planes are really important to understand and master. If you're going to go into rad tech, these body planes are really important because most of our x-rays are read according to these body planes. Okay, and a lot of, when you're doing CAT scans or mammograms, this comes into very important context when we're doing that. So there's a couple of different ways that we can divide the body up. All right, so then we have, the first one that's listed here is mid-sagittal. So when you have something, if we take the mid out and just do sagittal, sagittal is a plane that divides our bodies into a right and a left. Okay, and so if it's a mid-sagittal plane, then it's directly down the middle, right down the middle of the head, all the way through the belly button, and it gives you equal left and right halves. Now there's also something called a sagittal view, which is a slice or a section that gives us a left and a right, but it isn't necessarily equal. So if you're not down the middle, which is mid-sagittal, anywhere to the left or the right is considered a sagittal, so that will give you unequal right and left portions. okay? Two directional terms that come from a mid-sagittal plane or a sagittal plane is medial and lateral. So medial refers to something that's closer to the midline, to where lateral refers to something towards the side or away from the midline. So this gives us our example of our mid-sagittal. As you can see right here, this is mid because it goes right down the middle in the belly button. But if we were to move a couple of millimeters this way or a couple of millimeters that way, we would still have a sagittal section or a sagittal plane, but it would be an unequal version. Mid gives us equal left and right halves, to where sagittal gives us unequal. Okay? Medial refers to anything towards the midline. Lateral is towards the side or away from the midline. Then we can also create a section which is a vertical plane that goes from the top of the head down to the feet, but it gives us a front and back, okay? And so this is where we actually get a number of different terms come from this plane, but a frontal plane is also called coronal. So you'll find in medicine that they love to repeat numerous or make numerous terms for the same thing. So both of these planes are called, one is frontal, it's also called coronal. And so this is where we actually get a front and a back, okay? Now there's a couple of terms that also are synonymous with front and back, anterior and posterior. So anterior also refers to the front, to where posterior right here, refers to the back. There's two other terms that come from this bodily plane that are actually more animal terms or veterinary terms, but we also get the term ventral and dorsal. Okay, so ventral is synonymous with anterior, meaning front. Dorsal is synonymous with posterior, like a dorsal fin. If this were a dolphin or a whale, they would have a dorsal fin on the posterior side or on the back side. Okay, so those are terms that aren't listed here, but they are definitely important to know as well. Then we have a transverse plane. So transverse actually cuts us horizontally in half so that we get a top and a bottom. All right, so then we actually get a cut that's directly across the body so that we get a top and a bottom. Other terms that are similar to top and bottom, when we're talking about the top portion, it's also called superior. So when we make a transverse section, we're getting a superior, and then we get an inferior. So superior is towards the top. And so two other terms that mean towards the top are cranial, because that refers to cranium, and cephalic refers to the head or the brain, okay? And so these two terms mean head. If we go to the bottom part, we have the inferior portion. Another term that refers to towards the bottom, which is caudal. Caudal is actually referring to the tail. Okay, so these are terms that come from the transverse plane, which is horizontally cuts us into a top and a bottom. So this shows us our term. We have now this cut could be anywhere. It could be like it shows here, which is kind of underneath the breast line. This could be at the hip, or it could be farther down. So transverse just gives us a top and a bottom, or a superior and an inferior. And then when we're referring to superior, you'll sometimes see a cranial view or a caudal view or a cephalic view. And then when we're dealing with inferior, we're dealing with caudal, which means tail. Okay, true or false? The frontal view is when you divide the body into equal left and right portions. Okay, so remember, frontal gives us a front and a back. So we're not getting our side view here, so this would be false. Okay, a frontal view gives us a front and a back. If we were referring to an equal left and right half, that would be our mid-sagittal plane. Okay, so true or false? A radiologist dictates the report saying that a craniocaudal view was performed. This means that the film was shot from the top of the head downward towards the tail. And that, in this case, would be true, okay, because cranial came first and caudal. So that would indicate that we did go from the top to the bottom. If it was a caudal cranial, then that would indicate that we were going from the tail to the skull, okay? So now we're going to kind of further divide the body. We talked about cells and some of the terms revolving around that, and tissues. And so now we're going to talk a little bit about the abdomen. Now all of our body parts are important, but the abdomen holds quite a few organs within it. And so we do divide the abdominal region. There's a couple ways that we actually divide it up. We can actually divide it up into 9 anatomic regions that are generally identified from left to right. Okay, and we kind of do one row at a time, starting at the top, going to the middle, and then going down to the bottom. Okay, so this is how we can actually divide the abdomen into 9 areas, kind of our tic-tac-toe, so to speak. Generally, you'll start up here in the right upper quadrant, and we move this way. So we have our hypochondriac region. This kind of involves where the liver is. Chondriac refers to the rib cage, so hypo is under, so this is pertaining to the area that's under the rib cage. Epigastric refers to the area that's kind of in and around and above the stomach region. And then we have the left-sided hypochondriac region, which is the left side here, up underneath the rib cage. So these are numbered 1, 2, 3, going from right to left. Now we don't go down this way. If we're going to count again and look, we're going to go to the right side again. So our number 4 area is the lumbar region. Now this is because this is the lumbar area or loin area, okay, kind of associated with the lumbar area of the spine, which we'll get to in a little bit. Then our middle area is called the umbilical region. That's also the navel or the belly button, okay, and that's sort of right in the middle. That's our section 5. Section 6 is our left lumbar region. Then if we come over here to the right side, we have the inguinal region down here in the right lower quadrant. And then we have number 9 is the left inguinal region, and then number 8 is called hypogastric. And sometimes this can be the hard one to remember, because you'd probably think that, hey, this should be hypogastric because the stomach is here. This is still underneath the stomach region, but this area 8 is more correctly labeled hypogastric. Clinically, we oftentimes call this the suprapubic area because the bladder is in this area for females, but the more correct term is hypogastric. Okay. Now, this is great, and it is important to kind of know these, but these are more used for surgical and oftentimes ER terms, because if somebody comes in with a knife wound or a gunshot wound or some sort of trauma, they really like to localize the area because when you're going to describe it, it kind of gives us an idea of what could be injured, which could then give us the degree of urgency of how we need to deal with things. Clinically, though, when you're actually in a clinical setting, we don't usually use all 9 of these. These are more trauma-based and surgical-based. Generally, when we're clinically looking at things, we kind of divide things into 4 quadrants. So rather than doing 9, there's also a shorter way to do this, and it is the 4 quadrants. We have a right upper quadrant, a left upper quadrant, a right lower, and a left lower. Okay, and when you're using this, the belly button or the navel, the umbilicus, is sort of your center landmark. Okay, so this is more prototypically used in the clinical setting. The umbilicus is here, or the navel, it's the midpoint, and then you just make a cross, boom, boom, and then we have here our right upper quadrant, left upper quadrant, right lower, and left lower. And so that's why this is a little bit more what people have heard of, a little bit more recognizable, especially if you've gone to the doctors and they might try to have you pinpoint. If you're complaining of abdominal pain, being able to localize your pain is important because you can see the organs. Different organs are located in different areas. And if I've got left upper quadrant pain, it's probably not my appendix, which is in the right lower quadrant. And so being able to look at these areas and knowing the organs that are within this area, and you can see there's overlap. The small intestines are pretty much in all of these areas. The large intestines wrap around it. And so knowing your organs kind of helps to start to narrow down your diagnoses when you're looking at something as far as abdominal pain goes. Okay, so looking at the diagram of the 9 body regions, what number would be at the right lumbar region? So remember, if we go backwards, the right lumbar region, okay, so if we're going to count here, 1, 2, 3, so right lumbar region would be section 4, okay, which is C. Okay, so true or false, McBurney's point is the landmark for the 4 abdominal quadrants. Now, we didn't really go through McBurney's point. McBurney's point is listed in the book, but our basic landmark for the 4 points is not going to be this point. It's going to be the umbilicus, okay? McBurney's point, they talk about it in the book. McBurney's point is a point in here. It's about 2/3 away from the umbilicus. And generally, when you have tenderness here, as you can see, I'm kind of going in circles. This is actually the appendix. So if you have pain at McBurney's point, then it generally is suspicious for appendicitis. Usually you push down and lift up. And if you have something called rebound tenderness, where it actually hurts more when you release than when you press down, that's kind of indicative that we could be dealing with appendicitis. Okay. Okay. So we have some body cavities that we need to kind of talk about too. We talked about planes and cells, and now we have to, we talked about how cells build up to body systems and organs. Now we have to have specific areas where we protect these organs. And so we have body cavities that have certain organs that lie within them. And so I talked about these two words, ventral and dorsal. When we divide our body into it with a frontal plane, we get a front and a back. And so ventral is a synonymous term with frontal. And so when we look at the different cavities that are within, or the different subsections of cavities that are ventrally located, we are dealing with the thoracic cavity, which has the lungs and the heart, as well as the great vessels that come out of there. We also have the abdominal cavity that holds most of our abdominal organs. And then we have the pelvic cavity, which holds the urinary, as well as the ovaries and uterus, or prostate and all of the male organs, okay? So our ventral cavities are in front. Dorsal means posterior or back. And we only have one cavity back there, and that's the cranial cavity. So the brain and the spinal cord are the only dorsal cavities within the system. Everything else is ventrally located. So this kind of shows our body here. And so if we divide, if we go down here and do a frontal plane and go all the way down here, we will see that these cavities lie ventrally to that section, okay? And so the diaphragm is right here, and the diaphragm actually separates the thoracic from the abdominal cavity, okay? The diaphragm is our big breathing muscle. We'll talk about that a little bit later. And then when we're looking at our posterior cavity, it's basically the cranial, it's the dorsal. When you say, what's the one dorsal cavity that we have? It contains the brain and the spinal cord, so everything is posterior, okay? Sometimes people will lump the abdominal pelvic cavity together because it is close. Sometimes you'll just talk about the abdominal cavity. Other times they'll do the abdominal pelvic, and that will include those pelvic organs, okay? True or false, a body region located in front of the spine is considered to be within the ventral cavity. That would be true, okay? Only the brain and spinal cord or spine are located in the dorsal cavity, okay? So these questions are always a little bit funny when you have multiple blanks in a sentence. So it says the blank cavity is separated from the blank cavity by the diaphragm. So a better way to rephrase this would say the diaphragm separates which two cavities. So we just looked at that little picture back over here, and we saw that there was this particular diaphragm is right here. So superior to the diaphragm is the thoracic cavity, and inferior to the diaphragm is the abdominal cavity. So the answer to that question would be thoracic and abdominal, so that would be B, okay? Okay, Now we're just going to briefly go through the divisions of the spine of the vertebra or the back, and we do have multiple different bones located within our spine. Okay, the top portion, the very top portion, is called the cervical vertebrae, and there are 7 of those, and they are numbered C1 through C7. Okay, so that's counting from the top bottom going down. So we're going from cephalic or cranial downward. So C1 is closest or most superior, 7 going downward. Then our next set of vertebra are called the thoracic vertebra. They are then labeled, and there's 12 of those. They are labeled T1 through T12. Below that, we have the lumbar vertebrae, which there are 5, L1 through L5. And then we have the sacrum and the coccyx. The sacrum is a triangular shaped bone that is fused, and it actually makes up the portion below the lumbar vertebrae that actually attaches to the pelvic cavity. And then the coccyx is synonymous with the tailbone. That's the other word for the tailbone. And it's 2 to 4 bones that are semi-fused together. And so here is our bones, 1 through 7. Cervical are the very top, and the neck. Cervico is synonymous with neck. Then we have the thoracic region. Thoracic means chest. Then there are 12. So we start from 1 and go all the way down to 12. The next set, the next 5 are the lumbar, and they're the largest 5 because they have to support pretty much the weight of the entire body, and so these particular vertebrae are larger. And if people are going to have issues with their back, most of the time this is where it'll occur, because it can create, when you have problems with the discs here, it can cause low back pain and radicular pain into the legs, because these are, once again, the largest of the vertebra. And then we have the sacrum, which makes up the pelvic girdle. It's sort of the backbone of the pelvic girdle. And then here we have the tailbone of the coccyx. And true or false, as long as you know where the divisions are of the spine, you can count from either the top or the bottom to correctly identify each vertebrae. Okay, that is true, but you do have to know how many there are of each when you're going to go through and count. But yes, you can count either way. But we can't go backwards. We're always going from the top to the bottom. Okay, we wouldn't want to count backwards this way. Okay. Okay, and so here comes our directional terms. Now we've already discussed most of these in one way, shape, or form, because when we discuss the body planes, we then can get directional terms that come from that. So I'll go through these real quick. Superficial and deep. These are all antonyms of each other. Okay, they're opposites. So superficial means closer to the surface, to where deep means away from the surface or in deeper tissues. Anterior and posterior, we saw that when we divide our body into a frontal plane, we get an anterior, which is the front, posterior, which is the back. Now these two terms below it are also synonymous. Ventral and anterior are synonyms. Dorsal and posterior are synonyms, but these are antonyms because they are opposite of each other. So both of these terms come from a frontal plane, okay, or dividing the body with a frontal plane. These are the same thing, okay. Superior and inferior comes from a transverse plane that gives us a top and a bottom. But then we also get 2 other terms from that point. Cranial is associated with superior, as is cephalic. Cephalic's not listed here. Caudal means inferior or towards the tail. Okay, so these are antonyms of each other, superior and inferior. Cranial and caudal are antonyms. These 2 here are synonyms. These 2 here are synonyms. So this shows us, once again, our directional terms that we just kind of talked about. We already saw this picture similar, but it gives you an idea of when you go up, we're superior, we're cranial, we're cephalic. If we go down, we're caudal, okay? Dorsal is the back, ventral is the front, okay? Depending on what plane we're doing. Then we have some more terms, medial and lateral. We saw that when we did our mid-sagittal plane. Anything closer to the median or the middle is, or to the middle or towards the middle is considered medial. Anything away from the middle or towards the side is lateral. Distal and proximal are a little different than medial and lateral. Distal just means farther away from a specific point, and proximal means closer to a specific point. It doesn't necessarily mean towards the median or away from, but distal is away from the body, and proximal is closer to a certain point. Okay. Supine and prone can refer to two different things. It can refer to a body position. If you are supine, you are laying on your back with your stomach up. If you are laying in the prone position, then you are laying with your stomach down or with your back up. This can also go for our forearm. So when our palm is facing upward, then our hand is considered, or our forearm is considered to be in the supine or supination. If we flip over our hand and put our palm down, then that term is pronation. Okay, so this can refer, the supine and prone are actually a little bit more referring to our entire body position, to where supination and pronation oftentimes refers to movement of our forearm, whether or not our palm is up or down, although our body can also supinate and pronate as well, but that oftentimes refers to our forearm position. And then plantar and dorsal are actually terms that refer to the foot. Our plantar part of our foot is where the bottom part is. If we had a plantar wart, it's usually on the bottom of our foot. So the plantar surface of our foot is the bottom. The dorsal surface of our foot is actually the top part of our foot. We have a specific artery on the top of our foot called the dorsalis pedis. So the dorsal part of our foot is the top, the plantar is the bottom. And this just gives us some of our directional terms that we talked about. Okay, so common nouns can help in keeping directional terms straight. For example, something in close proximity is blank, and something that is in the distance is blank. So basically what we're doing is finding synonymous terms with these. We're looking for a synonymous term with something that's of close proximity and something that is in the distance. And so we kind of talked about those two terms. We have proximal and distal. So something that is close in proximity is proximal, and something that is farther away is distal, which would be D. Okay, so we covered this chapter. I know there's a lot of terms in here, but these terms really set the stage for what we're going to do next week in Chapter 5, where we actually start to hit the skin. So please make sure you take enough time to go through this and that you understand all these directional terms. They will come back over and over again. Any area of medicine that you go into is going to see these, so please make sure you spend enough time on these, on this section, because it does start to build to bigger things as we go forward. All right, so I'm going to go ahead and stop our tape, and I'll see you in the next video.